Hi, everybody. Welcome to our first event of this workshop series. The workshop series is called Queer Health Education, the first topic being social determinants of health. This is a three-part event series where we're all going to be unpacking different queer health disparities and what it means, what we can do. So just consider it like a primer into a bigger conversation. Oops. Oops. My name is Jordan Sanchez. My pronouns are they, she, and I am a healthcare enrollment coordinator for Bradbury-Sullivan LGBT Community Center. I live here in Pittsburgh. I work in Pittsburgh, and I work with LGBT centers along Western Pennsylvania.
My name is Owen Pudlander. I use he, him pronouns, and I am also a healthcare enrollment coordinator. I am based in Allentown and serve the Eastern PA region, connecting folks with affordable healthcare.
And my name is David Shelley. I am the Philadelphia enrollment coordinator, and my pronouns are he, him.
Today we have a special guest. Malcolm, would you like to introduce yourself real quick?
Sure. Hi, my name is Malcolm Soaries. I'm a digital creator. I work in copywriting and digital content creation, and I'm really excited to be part of the conversation today.
Thank you. So how is it going to work? The two other coordinators and I, we're going to set the scene, and then Malcolm is going to speak a little bit, and then we're just going to have an open conversation about the topic, see where the night takes us. Okay, so I wanted to start with the agenda, of course. We're going to talk about what social determinants of health means, different LGBTQI plus identities, and the relationship between queer and trans identities and social determinants of health. How does that manifest in queer health disparities, which I am now seeing as misspelled, so just imagine it's spelled right. And then Malcolm is going to speak, and then, like I said, we're just going to have that open conversation. Okay, so what is social determinants of health? What does that mean? I wanted to start off with discussing the Healthy People 2030, which is an initiative, a data-driven initiative under the U.S. Department of Health and Human Services that provides public health frameworks to help identify different priorities to improve the well-being of individuals and communities across the country. I like their definition of social determinants of health, which reads the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcome and risk. So that within itself is a lot to unpack. So I just like to think of it as the non-medical factors, right, that influence a person's health outcomes and quality of life. Like education level, job insecurity, food insecurity or security, social inclusion and exclusion. And as social workers, healthcare workers, queer folks, and LGBTQIA plus accomplices, allies, these are important to consider in health work and advocacy work because they impact the individual right and they impact the greater community. In terms of their mortality, morbidity, life expectancy, and healthcare expenditure. So going back to the Healthy People 2030, they have identified 5 different domains. So general grouping of SDOHs. These are them in no particular order. First, we see like the social and community context. So do these queer folks, do they have a community? What does their community look like? Is there representation in their town? Is there not? Is there advocacy work there? Second one being educational access and quality. What's a person's level of education? How was their educational experience when they were going through getting their education? Did they have student centers or diversity centers that really celebrated folks' identities and experiences, like a Pride Center or a Latinx Student Center? Something like that. Healthcare access and quality. Where are folks getting their healthcare services? Are they able to go to private centers? Are they going to clinics? Do they how's their experiences with the medical professionals, right? Like, are medical professionals have enough understanding of queer and trans health? Do they understand HIV prevention, intervention? Do they understand when the standard medical procedure is appropriate for a queer person? So if you're meeting with a lesbian patient and you say like, oh, you need to take a pregnancy test, like, how is that going to impact a person's experience in a medical setting? Fourth, economic stability. How much money are people making? Are they making enough? Are they below the federal poverty level? What kind of jobs are they holding, right? Is it a traditional 9-to-5 job with benefits, or is it something more stigmatized? And that can lead to other types of social barriers. And then lastly, the neighborhood and a built environment. What's being considered in the urban setting? Is there an understanding of the racial impacts that goes into urban planning? Is there a reckoning of the different types of oppression that has gone into urban planning? Stuff like that. So one thing to consider though is that there isn't a set taxonomy or criteria as to what is a social determinant of health. This is what the US government currently recognizes, but there's other types as well. For example, Canada also recognizes like Indigenous status and gender, race and racism, and historical traumas as types of social determinants of health. It's a growing list with a lot of different components, which is understandable, right? Because there's a lot of different factors that influences a person's well-being. So with that being said, I want to open it to a group activity. So we're going to use this Padlet. I'm going to drop this link in the chat and I'll give further instructions. Actually, Owen and David, do you mind dropping the Padlet link in the chat? Thank you. So we're going to open this Padlet. It's kind of like what do you call it in school? Like a whiteboard? Yeah, like a whiteboard. You can just write your ideas, your thoughts. I posed a question, what are some examples of social determinants of health? But I also want to broaden it to like, what are some other domains of social determinants of health that we haven't touched on before? And then we'll give that a few minutes. We'll give people time to input their ideas. We can discuss them and then we'll move forward. So I'm going to stop sharing my screen and then open up the Padlet screen. Okay, so for those that may or may not have used Padlet before, this is what it looks like. On the top is listed the 5 domains that we just talked about. Underneath are little plus sign buttons that you can add examples that fall under that domain. But if you'd like, I invite you all to add a section, add a different domain, add any examples of that domain. Yeah, we'll spend a couple of minutes here and then we can discuss and move on. Okay, cool. Thank you, everybody. These are really, really important and great examples. Okay, let me stop sharing my screen for a minute and open up the slides. Okay, so, as we all just went through together, there's a lot of different examples, different types of social determinants of health. But something when I was doing my research for this, a common understanding or that I came across between all the different examples, right, is that social determinants are constructed and shaped by the distribution of money, power, and resources on a global, national, and local level, and that they are directly responsible for health inequities, as we'll discuss more. So a way that it was conceptualized for me is that the unequal distribution of those factors influences the creation of policies, procedures, legislation, social norms, and so on. And then that impact of those trickle down to create various conditions that we all live in, which trickle down some more to create, power, privilege, minoritization, disenfranchisement of specific communities, and then the overlapping effect of those forms of oppression. So just something to keep in mind. We'll discuss that a little bit more. So like I was saying, the 5 domains that we discussed earlier, they're a good primer into this conversation, but there's also some limitations, as we know, in terms of how like healthcare and society at large is operated. But with that in mind, there's also room for expansion, right? This is why we do the work, because we see the inequities and we are determined to make that change. So we have systems that are rooted in justice, rooted in care, rooted in equity. Okay, so I'm going to pass the mic over to David, and he's going to share with us the connection between LGBTQIA+ identities and social determinants of health.
Thank you, Jordan. So when we talk about understanding queerness and the relation to social determinants of health, I'm going to just define a few terms here, just so everyone has a general understanding and basis in case they don't. So first, we'll start off with sexual orientation / identity, which is how one thinks of oneself in terms of whom one is emotionally or sexually attracted to. So the example of this would just be like LGBT, so lesbian, gay, bisexual, transgender. Next, we'll move on to romantic orientation, which describes an individual's patterns of romantic attraction based on a person's gender or genders, regardless of one's sexual orientation. So that refers to something like aromantic, biromantic, homoromantic, heteromantic. And then lastly, we have gender identity, which is one's most innermost concept of oneself as male, female, or a blend of both or neither, how individuals perceive themselves and what they call themselves. One's gender identity can be the same or different from their assigned sex at birth. So with all that being said, while we are born queer, and that should in no way affect us inherently, it unfortunately does in this system, as we are born into a binary and cishet system, and a really ethnocentric one at that in this country, especially those in the queer community who are BIPOC, trans, and gender nonconforming especially. So it's how do these social determinants of health manifest themselves in queerness? And some examples of that would be sexual and gender norms, unaffirming care or discrimination while receiving care at a doctor's office, which prevents patients from, they're less likely to go back and receive care again. And then some real life examples that we are experiencing today in our modern society, the Don't Say Gay bill in Florida, as well as Governor Abbott saying that transgender affirming care for children is child abuse. Those right there are two main examples of social determinants of health happening right now in our country. So with all that being said, I'm going to pass it over to Owen to continue this conversation.
Great. Thank you, David. So I am going to kind of combine what Jordan and David have already spoken about and just kind of bring that thread over to the relevance to the social determinants of health and their contributions to queer health disparities. I have the definition there on the slide and then a couple of little statements. And if people are curious about statistics regarding how the queer community has these disparities, there's a little link right there, because I'm not really going to get into statistics too much, but sometimes they are very interesting and enlightening. It's important to understand all the factors at play here. A reasonable assumption for a person to make is that healthcare itself is the biggest factor that impacts a person's health outcome and their overall well-being. It's in the name, however, it's shown that this is not the case. Though healthcare is intrinsic to health, it's a relatively weak health determinant, even when doing our best to acknowledge the way that healthcare may be interwoven into other determinants. I'm going to double down on the concept that social determinants of health are complex and overlapping systems. Much like your identity, you really can't disconnect yourself from your health. It follows that everything has some level of influence on your well-being. I'm going to get into a little bit of a definition that is made by the World Health Organization. They say that social determinants of health are shaped by politics and cultural notions, which create health disparities. This unequal distribution of health damaging experience is not in any sense a natural phenomenon, but is the result of a toxic combination of poor social policies, unfair economic arrangements, where the already well-off and healthy become even richer, and the poor who are already more likely to be ill become poorer, and bad politics. We should be proactive in thinking about the intersectionality of identities as well. When a person is a member of multiple marginalized groups, the effect on their disparities are compounding. The impact is not a simple equation of addition. If you really need to reduce it to some sort of math at all, think more multiplication, think exponents even. With regards to a couple examples, for that intersectionality, if we think about queer and trans people of color, healthcare inequities are significantly more pronounced for transgender people who are members of other marginalized groups. Implicit bias is a plague on the well-being of members of the Black community already. And just a little example, the percentage of those insured by the queer community in totality might not be far off from the general populations, but when you look specifically at the crossroad of queer and persons of color, there's a huge disparity. It's a jump from roughly 1 in 10 to 1 in 4. I'm going to go on to the intersectionality of disability and queerness. Both queer people and people with disabilities face disproportionately poor health outcomes when treated as separate, distinct demographic groups. And until relatively recently, disability was considered a health outcome and not even a demographic characteristic. It was just, that was it. So the lack of information as a result of that lack of thought and consideration about these populations is in and of itself a barrier to care. When we're discussing all these inequities, remember that policies are the means to correcting and bringing about equity. And if we don't have substantial, meaningful data about these populations, where do we focus our efforts? And I'm just going to get into a couple more real life examples of these things. Social exclusion is a huge bane on the queer community. It's a significant factor in the relationship between gender identity and health outcomes. This takes form as prejudice and stigma, violence, words and actions. These can impact a person's well-being and mental health. When we hear these onslaughts of micro and macro aggressions, and then there's the individual, institutional, and societal discrimination as well. These lead to the sort of snowballing effect on the well-being of our community members. As a trans man, personally, I've avoided care on multiple occasions because I'd rather suffer physically than perhaps seek care that might be discriminatory or even dehumanizing to me. In hindsight, I can joke that it was just physical distress and I survived, but, there's real life consequences to, that trauma avoidance tactic. People can seek treatment late enough that health outcomes are significantly worse. And this goes for as needed care, as well as annual checkups and recommended screenings. Even acknowledging my, my mindset in the hindsight while I was experiencing those health issues and then doing my best to avoid medical care, I was in physical and mental distress. The impact on my quality of life was very real and a source of stress. Another example that I want to speak on is the institutional discrimination within the medical system. There's a very real lack of training and education about queer bodies, whether it's incidental or intentional, it doesn't really matter which. We need to be asking more of the medical community in general. I know personally of providers who have not asked relevant questions of queer and transgender patients because they, the medical provider, don't want to feel uncomfortable asking questions about sexual practices or exposing their lack of knowledge. So that really has an impact on patients and their partners as well. As much as I would love every single person to be knowledgeable and empowered with regards to their health, wouldn't it make more sense for professionals to be assisting us in navigating our health? I personally feel that I have a solid foundation in how to maintain my health and how to navigate the healthcare system, but there's still gaps in my knowledge. And it's hard to ask a question if you don't know that the answer is going to be a concern. One more little thing, substance abuse issues are prevalent in the queer community and especially in the transgender community. Alcohol and other drugs are used to self-medicate, which can turn into a problem when there's no other support systems in a person's life, whether it's familiar or just social support. And then access to substance abuse services can also be very difficult for transgender and non-binary people. Providers can be insensitive, and frequently group sessions are segregated by gender without consideration for transgender and non-binary individuals. So that's just another hurdle when you're struggling. I feel like I've gone through a lot of different examples of these disparities, but I really want to note again that the disparities exist because of political and societal actions or inactions. Worse health outcomes are not because of us or our identities. They're the result of the systems in place, and we can work to make health equitable across all bodies and identities. With all that said, I'm really happy to pass this over to Malcolm and bring more insight to the topic that we have today. Malcolm?
Oh my goodness, you guys put the picture up and everything. Wow. Hi. Oh my gosh, I am floored right now. I cannot get over how much valuable information I just learned in such a short amount of time. So much information that I feel like should be talked about more frequently, but that's why I'm so happy that this conversation is happening. Thank you to everyone at the Bradbury-Sullivan LGBT Community Center. Everyone is just so lovely and so nice. David, I don't think I met you before, but you are just lovely and you just gave the most lovely presentation. I'm really, really honored to even be asked to be a part of this conversation. It's probably kind of obvious, but I don't work in healthcare. I'm not a social worker, but I am somebody who's very involved in social media, the social spaces, and a lot of conversations around LGBTQ issues. And as a creator myself, with a small platform, I think it's important to take opportunities like this to amplify, just encourage, uplift, and keep any kind of conversations going that are going to help the community and move us forward. I, again, am Malcolm Soaries. I go by pronouns he, him. And I grew up in New Jersey, and healthcare is a very interesting topic to discuss and for me to even reflect on, because growing up, I had parents who were middle to upper class. And so like we had money. I never really kind of had issues going to the doctor. I was very fortunate and very blessed to be raised in a household like that. I had parents who regularly took me and my brother to the doctor. We never really had any issues in terms of finances, right? And especially growing up as a Black person, and with a father who worked a lot with civil rights back in the day, those were things that we would still look out for. You know, my parents always wanted to make sure we were going to be in safe spaces wherever they took us to. And so again, financially, we never really had any issues as Black people, fortunately, gaining access to healthcare services. And so that's what made me start thinking about my personal identity, right? Talking about social determinants of health. That's actually a phrase that I never heard of before. I was not familiar with the phrase until I met, everyone at Bradbury-Sullivan, but it's a very interesting topic to think about because I never really pondered on the non-medical effects that are placed on our lives by environmental issues, by political issues, by social issues, right? So when we're looking at those factors of social determinants of health, I'm thinking like, wow, all of these things really did, personally play a role in a lot of situations in my life. Speaking of social and community context, I totally agree with what Owen brought up about the substance abuse issue. So I brought up growing up as a Black person and in a Black middle to upper class family. So my identity as a Black person, I always felt like I was very fortunate. I had a little bit of an advantage sometimes with access, not having to worry about money. Now my identity as a queer person, which, I feel like any queer person can relate, that was more of a journey. You know, I also grew up in a very Christian Baptist church where my dad was the pastor. So my identity as a queer person took a lot longer to develop, took a lot longer to figure out. My identity as a gender non-conforming person who, you know, shows up to Zoom things with long pink nails and maybe goes to dinner in 6-inch heels. You know, there were certain gender norms that were also shifting in my mind that I had to take the time to figure out for myself. And that was a lot harder for me, a lot more difficult, because it wasn't as familiar with my family, close people around me. That was more of a journey that I had to take on kind of autonomously, right? And so now my identity as a queer person, as I'm stepping into that, probably around, 18, 19, I spent my first year of college in New York City. And so I was thrown into that nightlife culture and everything. Like, I've been to probably close to every nightclub in New York City. And so I spent a lot of my 20s in queer spaces that were popularized. You know, when you look in the media, even going back to the 80s and the 90s and the days of the Club Kids and Studio 54, there's this safety that, queer people find in nightclubs. And just once the sun goes down, it just seems like things start happening for us, right? There's an issue there of balance, I think, when it comes to my personal story and my health. I definitely took advantage of alcohol and scenes that I shouldn't have been in, because that was tying into my mental health. So as I'm trying to figure out my identity as a queer person, I'm also trying to figure out why I'm not really happy, why I'm falling into depression, why I'm not taking my job seriously enough, and why I'm sabotaging, good situations in my life. All of those things kind of revolve and turn into your mental health. And it's really interesting how in the last couple of years, I think everybody has probably had to take a moment of some kind to address their mental health and really figure out what that means after the pandemic and through quarantine and everything. Queer people, we've been trying to figure out our mental health for a long time, since way before the pandemic. And I think what happens with social determinants, when I think again back on my experiences, I had to take back kind of ownership of my health, of my relationships with things, my relationships, with alcohol, my relationships with clothes. I felt like I needed to be in a stable place where I wasn't taking advantage of things for the wrong reasons. I wasn't sabotaging the things that were happening to me. And so I say all that to say, I think social determinants are inevitable for everybody. Where you grow up, who you're around, who you're raised by, you're always going to have external factors affecting you. And it can affect everything from your physical health to your mental health, to your emotional health, to your spiritual health. And I think it's really important to take back ownership of your process and your journey. Finding things, I know for me, like I can get lost in a crazy fantasy book. And, for some reason, like just watching Harry Potter fly off on a dragon sometimes helps me ease my mind, right? And it helps me to come back to the present moment. I read a lot of, kind of self-improvement psychology books about staying in the moment. And so just highlighting mental health, I think, will always be something that's important to me. And talking about all of these social determinants really inspires me to, be more aware of situations, of people, of moments that might affect, my health, my well-being, my quality of life. I do think that everybody is put here. If you are existing, you are breathing, then you are here for a purpose. And I think one of those purposes is to stay healthy and live as fulfilling a life as you possibly can. And that's doing the work on your own, and also acknowledging and understanding those inevitable social determinants that happen all the time. So again, I'm like really happy to just be a part of the conversation. I don't have a master's degree. I got my bachelor's in communications, just like all the basic people in school, So I'm like really, really interested in this topic, and I love learning more. And I hope that I can always, lend my voice or give an anecdote or just tell a funny story about anything that, again, will help educate, uplift, advance the LGBTQ plus community. So yeah, I'm looking forward to hearing more and talking more.